One of my translational studies of interest in what we here do in our more translational study group in the laboratory is looking why T-cell based therapies, cellular based therapies like CAR T-cell, but also maybe bispecific antibodies, is having a lot of potential in many types of lymphoma, not only DLBCL, but also mantle cell lymphoma and more recently follicular lymphoma, and why we do see responses in CLL, but only in a small minority of patients. And what our studies are suggesting is that as soon as T cells come into intimate contact with CLL cells, that they get an acquired T cell dysfunction. And what we have showed is that this T cell function, what we can measure in vitro, very much corroborates with this poor clinical outcomes after cellular therapy. And what we study is points how to improve it. And well, you can actually think of three different aspects there. One is, since we now know that this acquired T cell dysfunction is reversible as long as you prevent the contact of the T cells with the CLL cells, one way to maybe alleviate that problem is to first treat patients with targeted agents like Venetoclax, maybe also Ibrutinib, wait for the T cells to improve function, and then give as kind of a consolidation treatment CAR T cells or some other kind of cellular therapy. Second is that we are studying which factors are expressed by CLL cells that can impact the T cell function. And Fleur Peters of my group presented a poster on Sunday evening, or Monday evening, actually it was Sunday evening at the IWCL, where we showed that two membrane factors, namely CD24 and CD52, they actually might actively inhibit T cell function by interaction with a molecule called CLL10, which we are studying now. And a third option is that we earlier published that what we have seen is that as CLL cells interact with T cells, those T cells get a metabolic dysfunction, so the metabolic plasticity goes down. And we are now looking into methods to improve metabolic function, and we do that by both epigenetics and by genetic tricks, actually.